From VOA Learning English, this is the Economics Report in Special English. Ethiopia is one of the last countries in Africa to permit mobile banking. Mobile banking has proved to be profitable in the developing world, where many people still do not use banks. Earlier this year, the World Bank reported that 75% of the world's poor are unbanked. That is about 2.5 billion people. Banking through mobile phones lets people take part in financial services even if they are not near a bank. Until recently, Ethiopia and Zimbabwe were the only nations in Africa without mobile money services. Now, that has changed for Ethiopia. Belcash and Mbir are mobile banking technology providers. They have been setting up mobile banking and mobile money services in Ethiopia for the past 3 years. The Dutch company Belcash is working in partnership with banks to provide easier access to financing through bank accounts. Ireland-based Mbir is a mobile money service that works with microfinance groups where no registration with a bank is needed. Ethiopia's mobile phone industry is young, and wireless service coverage in the country is not well developed. The pressure on the wireless network is expected to increase. In the past 4 years, the number of mobile users grew from 3 to 17 million, and Ethiopia's telecommunications provider, Ethio Telecom, expects that number to grow to 40 million in the next 3 years. The government closely controls Ethiopia's telecommunications market. That means there is only one provider. Competition is not permitted. The National Bank of Ethiopia recently finished a draft order on how mobile banking services should be structured. This comes as international companies have shown interest in starting mobile banking services. For VOA Learning English, I'm Carolyn Presutti. This is the VOA Special English Technology Report. American lawmakers have expanded an investigation into the use of location tracking systems on mobile devices. This follows recent reports about the storing of information on the Apple iPhone, iPad, and iTouch. Questions have also been raised about Google Android devices. Some people consider location tracking to be a threat to personal privacy and security. Alan Friedman is the Research Director for Technology and Innovation at the Brookings Institution in Washington. He says all wireless companies do some amount of location tracking as part of their networks. Mr. Friedman says this information is usually stored by the companies, not the devices, and there are laws to protect it. He says law enforcement, for example, has to have a fairly high standard before it can access that data. And the phone company is also prohibited from selling that information. Congress discussed the issue of mobile privacy last year. Now, 2 researchers reported that location tracking information is being stored directly on Apple devices. They said Apple's newest operating systems gather global positioning system and timestamp information. The information is stored on the device in a file that is also uploaded to any computer that the device is connected to. The researchers say the information is available to anyone who has access to the device or computer. Alan Friedman says applications that a user buys or gets tricked into downloading might also be able to access this data and somehow misuse it. Apple said it is not tracking the location of your iPhone. The company said the phone simply keeps a database of Wi-Fi hotspots and cell phone towers near the user's location. Apple said this is meant to help your iPhone rapidly and accurately calculate its location when requested. In late April, leaders of the House Energy and Commerce Committee sent letters to some of the leading mobile device developers. These include Apple and Google. The letters asked for more information about their location tracking systems. Alan Friedman says there should be stronger controls over things like location data. He says we need to understand who is getting this information, how long they are keeping it, and what exactly they are doing with it. For VOA Special English, I'm Carolyn Presutti. For more stories about technology and for English teaching activities, go to voaspecialenglish.com.
I'm Alex Villarreal with the VOA Special English Technology Report. Mobile phone technology is quickly changing the way the world operates. Today, we tell about two new projects involving mobile health, also known as mHealth. Doctors and technology experts in London are developing a new way to test for sexual infections. The new device uses mobile phones and computers to help people find out if they have been infected with a sexual disease. People will be able to perform the test in the privacy of their own homes. People place urine or saliva on a small piece of paper. They place the test strip in a small device that contains a computer chip. Then they place the device in their mobile phone or a computer for testing. Within minutes, they receive information telling them if they have a sexual disease. And they receive advice on what to do next. Claudia Estcourt is with Barts and the London School of Medicine and Dentistry. She is also part of the research team working on the project. She says, "This isn't designed to replace traditional clinics. This is really opening testing up to people who might find it embarrassing or difficult to get into their clinic." Health experts say many young people are too ashamed to visit a clinic to be tested. This increases the risk of them passing on sexual diseases. The researchers hope the tests will help persuade people to be tested and reduce the number of sexually transmitted infections. Dr. Estcourt says the project is still 7 to 10 years away from completion. But she says it holds great promise for the future, especially in developing countries. In other news, researchers at the University of Toronto in Canada are studying a mobile phone system that may help people with diabetes control their blood pressure. The system collects blood pressure readings from home testing devices that have wireless technology. The readings are then sent to a healthcare monitoring system. Patients receive a mobile phone message telling them how they are doing. If their blood pressure is too high, they are advised to make an appointment with their doctor. Several high readings will cause the system to automatically contact the doctor. Patients in the study used the mobile phone system for 1 year. The researchers found that 37% of the patients were able to get their blood pressure under control. This compares with about 14% of patients using common equipment. For VOA Special English, I'm Alex Villarreal. I'm Alex Villarreal with the VOA Special English Development Report. International donors have promised almost $12 billion to the Global Fund to fight AIDS, tuberculosis, and malaria. The Global Fund held a 2-day conference in October in New York City. This is the largest pledge the 8-year-old organization has ever received. Stefan Emblad is the Director of Resource Mobilization. He said the fund received a 20% increase in contributions. Still, the pledges were $1 billion below the lowest estimate of the amount needed to fight the diseases effectively. In March, the Global Fund proposed 3 different plans, from $13 to $20 billion. The Global Fund is a partnership of public and private organizations. This fund has become the main source of money for programs to treat and prevent AIDS, tuberculosis, and malaria. Donations support programs in more than 140 countries. Nearly 3 million people are receiving treatment for the AIDS virus through Global Fund programs. 143 million people receive malaria drugs, and 7 million new cases of TB have been diagnosed and treated since the fund began in 2002. Global Fund officials estimate that their programs have saved more than 5 million lives. Stefan Emblad says these efforts will continue. He said the organization will not be cutting funding to any of the existing programs. Those programs will continue over the next few years to put more people on treatment and to have more prevention and care efforts. But they will not be at the same level as in the last 2 years. Mr. Emblad says some of the Millennium Development Goals are still reachable with this new level of funding. He said, "We could eliminate malaria as a public health threat in malaria endemic countries. We could also eliminate the transmission of HIV from pregnant mothers to their unborn babies." He said these goals could be met by 2015 if countries see them as most important. More than 40 donor countries, organizations, and businesses attended the conference in New York. The United States promised to give $4 billion over the next 3 years, the largest donor pledge ever. The United States was the first donor to the fund and remains the largest. France is second, followed by Japan, Britain, and Canada among the top 5. For VOA Special English, I'm Alex Villarreal.